Welcome to the Medi, your one stop destination for the deep, clear, and engaging pharmacy concepts. If you are a pharmacy student, healthcare profession, or simply a curious learner, you are in the right place. Our mission is to break down the complex topics into the simple, understandable lessons. In today's video, we are exploring one of the most important dosage form in pharmaceutics, that is tablets. From formulation steps to the type of excipients, granulation, and evaluation, we will cover it all. So be sure to like, share, and subscribe for more pharmaceutical content. So get your notebook ready because this is going to be an informative and the exam forecast. So let's begin with the basis of the tablet formulation here. Tablets are the solid dosage forms containing a specific amount of drug and excipients designed for oral administration. So they are the most widely used form of the medicines globally due to their convenience and stability. Okay, so the tablets can be swallowed wholly, chewed, or even dissolved depending upon the formulation. Okay, so they offer an excellent dose precision, easy administration, and a low product cost. So most tablets are compressed powders, but the way they are formulated makes a huge differences in the performance here. So they come in many forms like uncoated tablets, coated tablets, effervescent tablets, chewable tablets, or sustained release tablets, like that. So many varieties are there. So each type is designed based on the therapeutic goals and the patient needs here. So tablets are not all the same. They come in many types. So each designed for a specific purpose here, from regular swallowable tablets to the fast acting one. So delayed release are a chewable types, so the variety is very vast here. So their classification is based on the route of administration, method of manufacturing, or the drug release patterns here. So understanding these types is crucial for the pharmacist, healthcare providers, and the formulators. So in this video we will walk you through all the major type of the tablets with their uses and the unique features. So let's begin with the most basic one, the conventional tablets. So conventional or the uncoated tablets are the most common type of the tablets. So they are compressed with the active ingredients and the excipients and are meant to be swallowed whole. So these tablets disintegrate and dissolve in the stomach to release the drug. So they are the simple to manufacture, cost effective, and widely used across the medical conditions. Okay, so however they may taste bitter and are not protected from the gastric fluids. So uncoated tablets are typically used when taste masking or delayed release is not required. Okay, and next one is the sugar coated tablets. So sugar coated tablets are the compressed tablets coated with a thick layer of a sugar based material here. So the coating masks the unpleasant taste or the odor and improves the tablet appearance. Okay, so these are often large and heavier due to their thick coating, so which can affect the swallowing. Okay, so they mainly protects the drug from the light and air to certain extent. So however the sugar coating is a time consuming and expensive to produce. So they are often used in the pediatric formulations or vitamins and supplements. Okay, and next one is the film coating tablets. So film coated tablets are covered within a thin polymer coating, usually more effective than the sugar coating. So the film helps in taste masking, moisture protection, and sometimes control drug release here. So they unlike sugar coated tablets. So here film coating once remains light and easy to swallow. So the coating dissolves quickly in the digestive tract without altering the drug release significantly. Okay, so they are more durable during the handling and less prone to the cracking. So film coated tablets are widely used in the modern formulations due to their efficiency and the flexibility here. And next is the entry coated tablets. So entry coated tablets are designed to resist the acidic pH of the stomach. So they So their coating remains intact in the stomach but dissolves in the alkaline environment of the intestines. So this mainly protects the acid sensitive drugs or prevents the gastric irritations caused by certain drugs here. So they are commonly used for drugs like omeprazole, aspirin or enzymes. So patient must never crush or chew the entry-coated tablets or the protection will be lost. Okay. So they ensure the drug release occurs where it's most beneficial in the intestines. Okay. And next one is the chewable tablets. So chewable tablets are intended to be chewed before swallowing. So they are designed for the children's, elderly or anyone who are difficulty swallowing solid tablets here. So commonly flavored and sweetened, so they improve the patient compliance. Okay. So they are used for the vitamins, calciums, antacids and anti-allergic drugs. Okay. So chewing mainly allows the partial disintegration in the mouth, so aiding the faster onset of action here. So however, the proper formulation is needed to avoid the grittiness and a bad aftertaste. And next one is the effervescent tablets. So effervescent tablets are meant to be dissolved in the water before administration. So they contains an acid base components like citric acid and sodium bicarbonate, which releases the carbon dioxide. Okay. So this produces a fizzing action that helps dissolves the tablet quickly in the water. So they allows for the rapid absorption, pleasant taste and easy swallowing here. So effervescent tablets are popular for the electrolytes, pain relievers and cold medications. Okay. So however, they must be stored in the moisture proof packing to prevent the premature reactions. And next is the sublingual and buccal tablets. So sublingual tablets are placed under the tongue while buccal tablets are placed between the cheeks and the gums. So they mainly dissolve rapidly and allow the drug to be absorbed directly into the systemic circulation here. So this bypasses the first pass metabolism in the liver, leading to a faster action. So they are used for the emergency or the fast acting drugs like nitroglycerin. Okay. So these tablets must dissolve completely and should not be chewed or swallowed. So their small size and rapid effect make them ideal for the acute conditions. Okay. And next one is the oral disintegrating tablets. So ODTs are designed to melt quickly on the tongue without water. So they are excellent for the patients with the swallowing difficulties, especially the elderly and the children. Okay. So the drugs are absorbed through the mucosa or swallowed with saliva here. Okay. So these tablets must be a pleasant taste, quick disintegration and a low friability here. So they are commonly used for the anti-allergy, antidepressants and a pain relief medications. So ODTs improves the convenience and compliance in both clinical and home settings. Okay. And next one is the sustained and controlled release tablets. So these tablets are designed for the slow and steady drug release over a longer period. So sustained release tablets extended the drug action here, so reducing the need for the frequency dosing. And control release tablets mainly provides the precise control over when and how the drug is released. Okay. So they mainly improves the therapeutic efficiency and maintains the steady drug levels in the blood. Okay. So however, they must not be chewed or split as they may destroy the release the mechanism here. Okay. So these are ideal for the chronic conditions like hypertension, diabetes or asthma. And next one is the multi compressed tablets, that is MCTs. So these multi compressed tablets mainly consist of two or more layers of the materials compressed in a stages. Okay. So they includes layer tablets or a compression coated tablets, also called core tablets. Okay. So one layer may be immediately release dose, so while another provides a extended release here. Okay. So this allows for the combination therapy or timed drug delivery from the same tablet here. So they can also separate the incompatible drugs in the same formulation. Okay, so these are complex to the manufacture but highly functional and efficient. Okay, so from uncoated to the intercoated, chewable to the ODTs and sustained to the buccal tablets. So each type a vital role in the therapy here. So as we have seen, tablets comes in a wide variety of types based on their purpose, release behaviors and the method of use. So from uncoated to the intercoated tablets, chewable to the ODTs, sustained to the buccal tablets. So each type plays a vital role in the therapy here. So choosing the right type ensures the effectiveness, patient comfort and the therapeutic success. Okay, so understanding these categories helps the pharmacist, formulators and healthcare workers make a better decision. So don't forget to like, subscribe and share this video with your classmates. When we think of the tablet, we often focus only on the active pharmaceutical ingredient, that is API. So but did you know that the API usually makes up only a small fraction of the tablet weight here? So the rest is made of excipients. So non-active substance added to support the formulation is known as the excipients. Okay, so the excipients may not have a therapeutic efficiency but they are crucial to the tablet stability, effectiveness and manufacturability. So they mainly ensures the drug is delivered accurately, safely and in the right form. Okay, so from improving flow to help the tablet disintegrate in the body, each excipient have a specific job here. So in this video we will break down the key types of excipients used in the tablet formulation. So let's start with the very first category. Diluents are the fillers. So diluents, also called the fillers, are used to add bulk to the tablet here. So this is especially important when the dose of the drug is very small. This is especially important when the dose of the drug is very small and is insufficient to form a tablet on its own. Okay, so the diluents helps in creating the tablet of practical size for handling and swallowing here. So common excipients includes lactose, microcrystalline cellulose, mannitol, dicalcium phosphates. So some diluents like mannitol also added in a cooling sensation and are more used in the chewable tablets here. So lactose is widely used but may not be suitable for the patients with a lactose intolerance. Okay, so the choice of the filler depends on the factors like solubility, compatibility and compressibility properties here. So diluents are essential to ensure that the tablets have a uniform weight and dose distribution here. And next one is the binders. So binders are the agents that mainly promotes the adhesion of the powder particles, allowing them to form a cohesive tablet here. So they mainly gives a mechanical strength to the tablet by helping granules stick together during the compression stage. Okay, so common binders includes like examples are starch paste, polyvinyl pyrrolidins, that is PVPs, glycolatin and hydroxypropyl methyl cellulose, that is HPMC. So these are all the various commonly used binders here. So the binders can be added as a dry powders or in a wet solution form during granulation. So PVP is a water soluble and frequently used in the wet granulation here. So starch and cellulose derivatives are preferred for their cost effectiveness and compatibility. So the right binder mainly improves the hardness without compromising the disintegration here. So they are crucial for ensuring the tablet durability during manufacturing and the handling. Okay, and the next one is the disintegrants. So disintegrants mainly helps the tablet break down into smaller pieces once inside the digestive tract. So this is essential for the drug to dissolve and be absorbed effectively here. So they work by swelling, wicking, or forming pores to allow the fluid penetration into the tablets here. Examples are starch, sodium starch glycolates, cross caramelose sodium, and crospovidone. So sodium starch glycolate can swells 300 times its original size to break the tablet apart here. So crospovidone is a suspending agent that acts by very quick effectively in the fast dissolving tablets. So the disintegrants are usually added in the intragranularly, extragranularly, or both for optimal effects. So they are vital in ensuring the availability of the oral administered drugs. Okay, and next one is the lubricants. So the lubricants mainly reduces the friction between the tablets and the dye walls. Okay, so during compression and ejection, so they mainly prevents the sticking, which improves the tablet flow and protects the machinery from wear. Okay, so the common lubricants includes magnesium stearate, stearic acid, and talc. So magnesium stearate is widely used, but in excess, it can slow the drug dissolution here. So the lubricants are typically added at the final stage of the blending to ensure even distribution here. So they must be used carefully to avoid the affecting tablets hardness or the drug release. Okay. So hydrophobic lubricants like magnesium stearate requires a low concentration, usually below 1%. So a proper lubricant mainly ensures the smooth manufacturing and a better tablet finishing here. And next type of diluent is the glidants. So glidants mainly improves the flowability of the powder blend into the tablet dye cavity here. So the poor powder flow can causes the tablet weight variation and the content uniformity issues. So common glidants includes colloidal silicon dioxide, talc, and magnesium trisilicates are used. So they mainly reduces the interparticle frictions, enabling the powder to fill the dye cavity uniformly here. Okay, so the colloidal silicon dioxide is used in the micro quantities due to its a high surface area. Okay, so the glidants are especially important in the direct compression formulations. Okay, so even in a slight improvement in the flowability can mainly increases the production speed and the uniformity here. So they help maintain the consistency across the batches, ensuring the pharmaceutical quality standards here. And next is the miscellaneous excipients like colorants, flavoring agents, and sweeteners. So to improve the aesthetics and the patient compliance, especially in the children's, we use the colorants, sweeteners, and the flavoring agents. Okay, so the colorants mainly helps in the tablet identification and the branding here. So they can be a synthetic dyes or a natural colors. Okay, so the flavoring agents like vanilla, orange, or mint make the chewable or dissolving tablets more palatable here. Okay, and sweeteners like sorbitol, aspartame, and saccharin are used in the sugar free tablets for the diabetic patients. Okay, so these excipients are critical in ODTs, chewable tablets, and pediatric formulations. So however, they must be used within safety limits as defined by the pharmacopoeias. So good flavor masking mainly improves the medication adherence in the patients with a taste sensitivity here. So even though they are non-therapeutic, but these excipients contribute to overall treatment success. Okay, so in conclusion, excipients are the silent uh, architects mainly, so behind every successful tablet. So they don't treat diseases, but without them no tablet would function as intended. Okay, so each excipient plays a unique role in processing structure, drug release, and the patient experience here. So understanding their formulations helps formulators choosing the right blend for each drug. So from diluents and the blinders to disintegrants, lubricants and flavoring agents, all are essential. So formulation science is about balance, and excipients are the key to achieving that harmony. And next is the method of preparation of the tablets. So the tablet may look simple, but their manufacturing is a highly controlled and a scientific process. So the method chosen depends on the drug properties like flowability, moisture sensitivity, compressibility, and the stability here. So the goal is to produce the tablet that are uniform in weight, strength, disintegration, and the drug content. So there are mainly three methods are used for tablet preparations like wet granulation, dry granulation, and direct compression. So each method has its own equipment, excipient choices, and quality considerations here. So let's begin by understanding the first and most commonly used technique, that is the wet granulation. So wet granulation is the most widely used method of tablet preparation here. So it involves the formulation of the granules by adding in a liquid binder to the powder mixture. So this process involves flowability, compressibility, and uniform distribution of the drug and the excipients. So the main steps includes mixing the API with the diluents and other dry ingredients. Okay, and in the next step, add a binder solution to form a damp mass here. After that, screening the wet mass through a sieve to form a granules. After that, drying the granules and sieving them before compression. So wet granulation is suitable for most drugs except those that are moisture heat sensitive. Okay, and next one is advantages of this wet granulation method. So wet granulation methods offer several advantages. It mainly improves the tablet hardness, content uniformity, and minimizes the dust. So it mainly allows for the use of the fine powders that would otherwise have poor uh, flow properties. Okay, so the tablet produced are mechanically strong and less likely to chip or break here. So they also allows better control over drug release characteristics here. So however, the process is a time consuming, expensive, and requires an specialized equipment. There are also the risk of drug disintegration due to their moisture or the heat drug during the drying process. So despite these limitations, wet granulation remains the go-to method for the formulations needing the maximum control here. So let's now move on to the next method designed for the moisture sensitive drugs, that is the dry granulation. So dry granulation is used when the drug is sensitive to heat or a moisture. So in this method, no liquid binder is used and no drying is required here. So the powder blend is compressed to form a large slugs or the ribbons which are then milled into the granules here. Okay, so the two common techniques are slugging and the roller compaction. So the slugging mainly involves the compressing the powder into a larger tablet using a heavy duty tablet press. What is it? Heavy duty tablet press. Okay, and roller compaction mainly uses two counter rolling rollers to form a ribbon of compressed powders here. So the resulting granules are then sized and compressed into the tablets. Okay, dry granulation mainly reduces the process steps but requires a material with a high inherent compressibility here. Okay, and next one is the pros and cons of this dry granulation. So dry granulation is ideal for the heat and the moisture sensitive drugs like aspirin or antibiotics. It mainly eliminates the need for drying and reduces the production time and the energy cost here. So few steps mean reduce the risk of the material loss or degradation here. However, the dry granulation requires drug or excipients with an excellent compressibility here. So the granules produced may be in a less uniform compared to wet granulation. They are also at a risk of equipment wear due to the high pressure compactions. It's not suitable for drugs within a poor flow or binding properties. So overall, it's a cost effective and efficient alternative for the suitable formulations here. Okay, and next one is the direct compression. Okay, so direct compression is the simplest and the fastest method of tablet production. So however, the powder ingredients are blended and directly compressed into the tablets. No granulation step method required here. Okay, so here it's ideal for the drug and the excipients with the excellent flow and the compressibility here. So this method is especially useful for the moisture and the heat sensitive drugs. Okay, so it mainly reduces the manufacturing time, labor and cost significantly. So however, only a limited number of materials are suitable for direct compression. So commonly used excipients includes microcrystalline cellulose, anhydrous lactose, calcium phosphate. So while efficient, it depends tight control over the raw material properties. So let us see the benefits and limitations of this method. Like direct compression method mainly offers the numerous benefits like speed, uh, simplicity and a fewer processing steps. It mainly reduces the material handling and the exposure, so which is helpful in the contamination sensitive environments like that. So it also leads to the better stability as there are no exposure to the moisture or the heat here. Okay, so however, it's not suitable for drugs with a poor compressibility or low dose uniformity. So the powder segregation during the mixing can causes a convenient variations between these tablets. So formulations must choose an functional excipients that supports flow, binding and disintegration here. So despite these limitations, direct compression is preferred for high speed large scale production. So it's widely used in the vitamins, antacids and fast dissolving tablets. Okay, so here is a small summary for all these methods. Like wet granulation offers the best control, but is complex and costly. But dry granulation is a moisture free and efficient, but limited by powder properties here. So direct compression is the most economical and the faster, but requires an specialized equipment. So each method has its own unique advantages and limitations, and the choice mainly depends on drug stability, flow properties, dose size and intended release profiles. Okay, so a well chosen method mainly ensures the tablet uniformity, strength, stability and the performance here. So next time you take a tablet, remember a lot of science goes into that tiny dose. Okay, introduction to the tablet punching. So tablet punching is the process of compressing the tablets or the granules into in a solid tablet using in a specialized machines here. So this step mainly transforms the blend formulation into in a precise, uniform and a portable doses from here. So whether it's in a simple round tablet or in a complex multi-layered one, so it all brings with the right punch. Okay, so tablet punching machines are all at the heart of the mass production in the pharmaceutical industry here. They ensures the accuracy in the weight, thickness, hardness and the dosage uniformity. So let's explore how these machines work and the types used in the tablet manufacturing here. So the basic principle of the tablet punching means, so the tablet punching works on the principle of compression between the two punches inside a die. So a die cavity is filled with a specific volume of the powder or a granules. So then the upper punch descends to compress the powder while the lower punch provides a support here. Okay, so together they apply force that transform the loosen materials into a compact tablet here. So the compression pressure can be adjusted depending on the tablet type and the drug characteristics. So once compressed, so the lower punch rises to eject the tablet from the die. So this process is repeated thousands of times per hour in industrial machines. Okay, isn't it? So precision in this step ensures the uniform size, shape, and content in every tablet. Okay, so let's see, there are parts of the tablet punching machine. So a tablet punching machine have several important parts so that works in a perfect coordination. The first one is the hopper. So it mainly holds the tablet bun and feeds it into the feed frame or a feeding machine here. So observe the diagram here. So here it is a hopper. Okay, so the die define the shape and size of the tablet here. So while punches compress the powder. Okay, so upper and the lower punches move vertically inside cam tracks, so driven by a mechanical or a hydraulic systems. So the turret is in a rotating disc that holds the multiple sets of the punches and dies for a continuous production. So observe the diagram. So here it is clearly that all parts are seen. So cam track mainly controls the motion of the punches here, which ensuring the precise timing during the filling, compression, and the ejection. So other components includes pressure rollers, ejection cams, and dust extraction ports. So each part must be aligned correctly to produce the tablet safely and consistently here. Okay. First is the single punch tablet machine, that is the eccentric tablet press is the simplest form of the tablet compression. So it is mainly uses one set of punch and die, making it ideal for the small scale production or R&D labs. Okay, so powder is filled into the die cavity and a single upper punch compresses it into a tablet here. Okay, these machines mainly operates manually or within a motor, producing up to 100 tablets per minute. Okay, so they are easy to use, maintain, and cost effective for limited batch sizes here. So however, they lack the speed and the precision required for the industrial scale operations here. Single punch presses are widely used in the uh, academic industries, pilot studies, and industrial formulation trials here. So despite their simplicity, they provide a valuable insight into the compression behavior. Okay, and next one is the rotary tablet press, that is a multi-station press. Okay, so the rotary tablet press is used in the large scale manufacturing. It mainly contains multiple sets of punches and dies arranged on a rotating turret. Okay, so as the turret spins, each station performs the step of filling, compression, and ejection in a sequence. Okay, so underline this line: filling, compression, and ejection in a sequence. Okay, so the rotary presses can produce thousands of tablets per minute with a high uniformity here. So they come in a single rotary or in a double rotary designs, depending on output needed. So the machines offers mainly adjustable speeds, pressures, and dwell time, making them versatile for the different formulations here. So they also includes automation, digital controls, and real-time monitoring for quality assurance. So the rotary presses are the industry standards for mass tablet production in the pharmaceuticals and the nutraceuticals. Okay, so next let us see the tablet tooling, that is punches and dies. So the quality and the shape of the tablet depends heavily on the punches and the dies used. Okay, so these are known as toolings. Okay, so the punches are usually made of a hardened stainless steel or carbide for durability. So there are mainly two types, that is B tooling for standard sizes and D tooling for large tablets. So the die cavity determines the tablet size here. So while the punch face creates designs like logos or scores, okay. So the score tablets help dose easily, while embossed punches aiding brandings here. So the tooling must be precisely measured and regularly maintained to avoid the variations and the defects. So incorrect or worn out punches can cause problems like capping, lamination or sticking. So tooling design directly impacts the tablet aesthetics, identification and the performance here. And next is the evaluation of the tablets. So evaluation is the process of checking the tablets for quality, safety and the performance. So it mainly ensures that each tablet meets the pharmacopoeial standards and delivers the right dose to the patient. So from appearance and the hardness to disintegration and the dissolution, so every aspect is very carefully tested. So evaluation is crucial during the formulation development, batch release and regulatory approvals. So poorly evaluated tablets can lead to the treatment failure, patient harm or product recalls. So let's now explore the key parameters used in the tablet evaluation, starting with the basic appearance and the dimensions. So the first parameter we evaluate is the appearance of the tablet. So its visual and the physical look, okay. So this includes shape, color, size, texture, uniformity and the presence of marks and logos, okay. So a good tablet should be free from cracks, chips, discoloration or contamination here. So the appearance directly affects the patient acceptance and the brand recognition here. So the tablet dimensions like a diameter, thickness, curvatures are also measured using calipers or micrometers, okay. So these helps ensures consistency effectively in coated tablets, where variation affects coating uniformity here. So any deviation from the expected size or color may indicates the manufacturing issues or ingredient instability, okay. So thus appearance is not just a cosmetic, so it reflects overall quality and care in the manufacturing, okay. And next one is the weight variation test. So the weight variation test mainly ensures that each tablet contains the correct amount of drug. It checks the uniformity of the weight across a batch by weighing individual tablets and comparing them to the average here. So for uncoated tablets, a sample of 20 tablet is usually taken and weighed individually. So after that, according to the pharmacopoeia, the tablet should be deviate from the average weight by more than specified limits. For example, tablet weighing 82 to 50 mg should not vary by more than plus or minus 7.5%. So large variation may indicate the poor flow, uneven dye filling or segregation during the mixing. So the weight uniformity is especially critical for low dose drugs, so where even in a slight error can dangerous here. So this simple test is a vital in ensuring the dose accuracy and the therapeutic reliability here. And next test is hardness, that is the crushing strength, okay. So hardness is also called as a crushing strength, which mainly measures the force required to break the tablet here. So it mainly reflects that the tablet mechanical integrity, so which is important for packing, shipping and handling. So the test is performed by using a Monsanto hardness tester, Pfizer hardness tester or digital hardness machines, okay. So if a tablet is too soft, it may crumble during process or transport. So if it's too hard, means what will happen, it may fail to disintegrate properly, delaying the drug release. Okay, so hardness values typically ranges from 4 to 10 kg per centimeter square, so depending upon the tablet type. Okay, the right balance ensures that the tablets are strong and able to break down in the body as intended here. So this test helps in optimizing the binder concentration and compression forces during the manufacturing. And the next test is the friability test. So this friability test mainly checks how easily a tablet can chip, break or crumble during handling, packing and transportation. It mainly helps to ensure the mechanical strength of the tablet here. Okay, so to measure the physical strength of the tablets and ensures they won't lose the mass or shape during the handling, we have to conduct this test. Okay, so what is the procedure for this test means, here we will use a fibrillator. It is an apparatus which mainly consists of a rotating drum with a curved valves. Okay, observe the diagram here. So this is the fibrillator. Okay, so how to do this test means, first weigh a sample of tablets, nearly usually 20 tablets, and then place them in a fibrillator. Okay, rotate the drum for 100 times at 25 rpm for 4 minutes. So 4 minutes, for 4 minutes we have to conduct this test. Okay, after 4 minutes remove the tablets and remove the dust and weigh them again. Okay, initially we took the reading and finally again after the test we are taking the reading here. Okay, that is the weight. Okay, first we will find this friability by calculating friability percentage loss by using this formula here. In this formula it has a friability is equal to initial weight minus final weight by initial weight into 100. Okay, by using this formula we will find out the friability here. So here acceptance criteria means the weight loss should not be less than 1%, and if more than 1% means the tablet fails the friability test. Okay, so and next test is disintegration test. So this disintegration test measures the time is taken for a tablet to break down into a smaller pieces. Okay, so this is essential for the drug to dissolve and to be absorbed in the body. So the test is mainly performed by using a disintegration apparatus within a 6 tubes and a basket track. Okay, so the tablets are placed in the each tube with water or a buffer at 37 degrees centigrade, simulated body temperatures. Okay, so the basket moves up and down to mimic the gastrointestinal motion. Okay, so for uncoated tablets the disintegration should occurs within 15 minutes, so unless otherwise specified. If a tablet fails this test, it may signals the problem with the binders, lubricants or the compression. Okay, so the disintegration is the gateway to the drug release, making this test vital for the bioavailability here. And next test is a dissolution test. So the dissolution test mainly evaluates how fast and how much the drug is released from the tablet into the solution. Okay, so this test mainly simulates the drug's behavior in the gastrointestinal tract and helps predict bioavailability here. So it is conducted using an USB apparatus, one basket and two paddles in media like water or a buffer at 37 degrees centigrade. So samples are withdrawn at a specific intervals and analyzed using a spectrophotometry or HPLC. Okay, so the results are expressed as percentages of drug release over time, so compared to the reference standards. So the dissolution profiles are critical for control release tablets, so where timing is everything. Okay, so any deviation can add to reduce the effectiveness or the toxicity here. So this test is one of the most important tool in formulation and quality control. And next test is content uniformity. So content uniformity mainly ensures that each tablet contains the intended amount of the active drug, especially for the low dose tablets. So 10 tablets are randomly selected, dissolved and analyzed for the drug content here. So using an HPLC or UV spectroscopy, So according to the pharmacopoeia standards, so individual dose content must be done within 85 to 150% of the label claim here. So this test is crucial for the drugs where even a slight variation can affect the safety or the efficacy here. Okay, so if your tablets show a poor content uniformity, it may be due to inadequate mixing, segregation, or poor granulation. Okay, so for high potency drugs, uniformity is more important than the weight variation. So this test is a direct measure of dose reliability and the therapeutic consistency. Okay, so without it, patient safety cannot be guaranteed. So in summary, the evaluation of the tablets involves the multiple tests so that assess both physical and chemical properties here, from appearance to the disintegration. So every parameter is carefully measured to ensure the tablet performance and the safety here. Okay, so these tests helps identify formulation problems, optimize the production, and maintain the regulatory compliances here. So only tablets that pass all the tests are released for distribution and use. Okay, so skipping or ignoring these tests can lead to the product recalls and adverse effects or treatment failures. Okay, you are a student, a pharmacist, or a researcher, remember evaluation is the final quality checkouts. Okay, and next one is the what are tablet defects. So even with the advanced missions and the precise formulations, our tablets can develop a various physical flaws during the manufacturing. So these flaws are called defects. So and the effects in the appearance, strength, or performance of the tablet here. So these defects can arise due to improper formulation, equipment issues, environmental conditions, or operator errors. So they are classified into a mechanical defects are process related defects and visual or cosmetic defects. So identify the cause of the defect is essential to ensure the product quality and the patient safety here. So let's explore the most common tablet defects, their causes, and how to prevent them. Okay, the first one is the capping, that is a top layer separates. Okay, so capping is a common defect where the top or the bottom layer of the tablet separated from the body here. Okay, so once again I am repeating. So where the top or the bottom layers of the tablet get separated from the body here. Okay, so it usually occurs immediately after compression or during handling and packaging. So the main causes of the capping is air entrapment. Okay, so in the granules during the compression. So otherwise some other factors like low moisture content, insufficient binders, or worn out punches. So it can also happen if the tablet formulation lacks plasticity and does not compress uniformity. Okay, so to prevent capping, what we have to do means use a proper granulation technique. So optimize the binder concentration, ensures that tooling is in a good condition or not. Okay, so maintaining the proper compression speeds and dwell times also helps in preventing the capping here. So a capped tablet is not just a defective in the appearance, it may also affect the dosage accuracy also. Okay, so next type of tablet defect is the lamination. So that it means tablet splits into the layers here. Okay, so the lamination is similar to the capping but involves the separation into two or more distant layers. Okay, so this defect mainly results from the air entrapment or excessive fines or too much lubricants in the blend. Okay, so it often occurs when a compression force is too high or uneven, so mainly causing the internal stress here. So the layered separation maybe happen during the ejection or even during the post compression dryings. So improper granule size distribution or over dried granules can also leads to the lamination here. So preventive measures includes using an appropriate particle size, reducing the compression speeds, and avoiding the excess lubricants. Okay, so the good granulation and the proper compression steps also helps eliminate the trapped air here. Okay, so the laminated tablets are structurally weak and pose a risk during the transport and the packing. Okay, and next one is the cracking, especially surface cracks or the fractures. Okay, so cracking refers to the tiny breaks or the fractures on the surface or edges of the tablets here. So it usually occurs due to the rapid expansion of the granules or poor tablet ejections. Okay, so crack can form if the tablets are too hard and brittle, or if compression is not uniform. Okay, so another cause is insufficient drying, which leading to the expansion of the residual moistures during the packing here. Okay, so improper punches mainly, mm, that is improper punching alignments or sharp edged tooling may also damages the tablet surface here. So to avoid cracking, optimize the granulation moisture, use just a rounded punches, and monitor the drying time. So it's all essential to maintain the right level of binder and plasticity in the formulation here. Okay, so the cracked tablets may break apart during handling, resulting into the loss of dose or instability later. Okay, so next one is the sticking and picking. Okay, so that means the material gets sticks to the punches. Okay, so the sticking mainly occurs when the granules stick to the punches surfaces, while picking refers to the sticking specifically to the embossed areas like logos. Okay, observe the difference. So sticking means that the granules may get stick to the punch surfaces. So whereas in case of picking, they refers to the sticking specifically to the embossed areas like logos. Okay, so these defects are often caused by the excessive moistures, inadequate lubrications, or low melting point binders. So they results in the rough, uneven tablet surfaces or loss of imprint clarity here. So poor drying of the granules or hygroscopic ingredients can worsen the sticking here. Okay, so to prevent this, improve the granule drying, increase the lubrication concentration, or coat the punch face with the anti-adherent agents. Okay, so the punches should also be cleaned and polished regularly to avoid the material building up here. So in some cases, a change in the binder type or switching to the non-stick punch coating may be necessary. The sticking and picking reduces the tablet quality and can disturb the large scale production efficiency. Okay, and next one is the chipping and edge erosion. So chipping is the breakdown of the tablet edges during the compression or handling. Okay, so this usually occurs due to the insufficient binders, low moisture, or too much friability in the formulation. So it can also caused by the worn out punches and improper injection settings, or tablet hitting die walls. Okay, so the tablet edges are more uh, vulnerable because they receive the most mechanical stress here. So to prevent the chipping, ensure the proper lubrication, maintain equipment, and optimize the granule hardness and moisture here. Okay, so use of the anti-chipping agents and rounded toolings can also help to reduce this edge erosion. So the chip tablets often fail friability tests and may not meet the aesthetic or the structural standards here. So such defects are unacceptable in the high precision or coated tablets. And next one is the double impression or duplicate marking. Okay, so double impression occurs when a tablet receives the same imprint twice. Okay, so usually due to the movements of the punch after printing. So it is commonly seen in the rotary tablet machines with punches that have a loose or a worn guide keys. So this difference affects the appearance, branding, and regulatory compliances. So especially for marketed uh, prescription drugs. Okay, so the double impression may also confuse consumers or leads to the mistaken identity of the tablets. So to prevent it, ensure that upper and the lower punch are properly tightened and punch guides are aligned or not. Okay, so the toning should be checked regularly for wear and tear, and cam tracks must be correctly adjusted. So sometimes switching to non-embossed punches is advisable for moisture sensitive or sticking prone formulations. So double impressions are cosmetic, uh, but in regulated markets, even minor visual defects can fail or a batch. Okay, so in summary, the tablet defects are caused by multiple factors like formulation issues, mission errors, or environmental conditions. So the common defects include capping, lamination, cracking, sticking, chipping, double impression. So each defect impacts tablet performance, appearance, and the patient trust. So regular inspection, proper tooling, maintenance, and optimized granulation can reduce these problems. Okay, so using controlled environments, performing in the process checks, and applying a good manufacturing practices is very essential here. So understanding the tablet defects not only improves the production quality but also saves a cost and prevents the recalls here. So every pharmacy professional must be trying to identify the double shooting and prevent these issues. Okay, and next step is packing of the tablets. So once the tablets are manufactured and pass all the quality control tests, so the next crucial step is packing. So tablet packing mainly ensures the protection, stability, and the patient convenience here. So it mainly preserves the tablet integrity right from the manufacturing unit to the patient hands. Okay, so what is the importance of this tablet packing means, tablet packing mainly protects the tablet from the moisture, light, air, and contamination, and which mainly preserves the drug potency over the product's shelf life, and also it provides the unit dose accuracy and the patient compliance here, at the same time allowing the labeling, traceability, and the tamper evidence. Okay, for this purpose we will pack the tablets properly here. And there are so many types of packings are there. So here the tablets packing mainly of two types, like primary packing and secondary packing. In case of primary packing, the material that directly come in contact with the tablet here, so that is indicated as the primary packing here. Okay, so the tablet is intimate contact with the packing material here. So in case of secondary packing, the external covering that holds one or more primary packs are called secondary packs here. Okay, so let us see about this primary packing types. Again, this primary packing is of three types here, like blister packs, strip packs, and bottle packs. So first one is the blister packing. This is the most common type of packing we will see. So the tablets are sealed in individual cavities made from PVC or aluminum foils, and it offers the excellent protection and easy to use. Okay, and next one is the strip packing. So here the tablets are sealed between the two layers of foil, usually aluminum. So after it offers the high protection against the moisture and the light here. Okay, in case of bottle packing, the tablets are filled in a plastic or a glass bottles and then sealed with the caps. So common for the bulk or over the counter medication, this bottle packing is highly suitable. So whereas coming to the secondary packing, so here the secondary packing mainly involves outer boxes, cartons or printed sleeves. So these packing mainly contain some important informations like brand name, generic name, dosage instructions, expiry and batch numbers, storage conditions like that. Okay. So different materials are used in the tablet packing, which includes polyvinyl chlorides, aluminum foils, high density polyethylenes, and paper boards and cardboards. Okay. So let us see some special packing requirements like desiccants to absorb the moisture inside the bottle here, and some child resistant closes to prevent the accidental ingestion, and tamper evident seals to show if the product has been opened or not, and you need those packs for hospitals use. So this packing of the tablet is a crucial final step in the pharmaceutical manufacturing processes here. So it is not only for to protect the product from it is not only protects the product but also ensures the regulatory compliances, patient safeties, and commercial appeals. An efficient packing system balances the protection, cost, ease of use, and the sustainability. Okay. So we hope you found this video helpful in understanding the causes and the solution of the tablet defects. Don't forget, pharmaceutical quality starts with attention to every detail in the production process. So if you like this content, please like, subscribe, and share it with fellow pharma learners. So comments below if you would like to cover the tablet coating evolution or troubleshooting in more depth. Okay, so stay tuned with the Mediqueries for more smart simplified pharma videos. So until next video, keep learning, stay curious, and ensure every tablet you make is safe, strong, and flawless. So thank you for watching. See you in the next session.